Hello beautiful ladies, welcome to today's video. It's kind of chatting today about the situation that I have with my breast, based on the name of the video. You probably know what I'm gonna be talking about. The reason why I'm filming this video too is to spread the awareness of the disease that is very rare, but for some reasons it happens sometimes and people are afraid, people don't feel comfortable talking about it. And as far as I know, there is 500 cases worldwide so far. So based on that, it's something that doesn't happen on a daily basis with everybody, but it calls Mondor disease. So I was diagnosed with Mondor disease just recently, about a month and a half ago. So as you guys know, I am a person who trying to conceive baby number 4 after 3 miscarriages. And it's not a joke. Miscarriages happen, and I'm just spreading the awareness on my channel. I'm just talking about it a lot and showing that it's a part of our life, and sometimes it's a part of our daily routine. And yes, unfortunately miscarriages are very common, especially nowadays. So let's say me personally had 3 last year. So okay guys, about 2 months ago I started having some pain and discomfort in my left breast. I called my OB and I told the scheduler that I'm in pain, my left breast hurts, and I need to be seen as soon as possible. So I went to see my OB within 3 days after I called, and which is fast. And my OB told me that I was on my period, by the way, and my OB told me that it's kind of it happens when you are on your period, especially after 30. So it's kind of a cyst or something, but it's gonna go away once you stop your period, once you complete your period. And yeah, it's gonna get better 100%, but just in case, let's do the ultrasound. And they scheduled the ultrasound for me in 3 weeks. I'm like, okay, this is very helpful. It's gonna get better and it's gonna go away on its own. Plus I have an ultrasound to confirm that nothing serious is in there. And I just went home peaceful and hopeful. But next day, or in a day or 2, I started having more pain, more discomfort, more uncomfortable feelings in my breast. I realized that the thing is growing. I had just one cyst that was small, but I did feel it a lot. And then I kind of have more, but they are lining up. It seems like and feels like a cord that goes from my underarm to my nipple, and that cord was growing on a daily basis. So let's say first week it was just maybe this long, then longer, and I had scheduled ultrasound in 3 weeks, and I just couldn't wait because I was in pain. And second thing, it just was super scary to wait. So yeah, I decided to do the ultrasound as soon as possible, and in this case I went to my local emergency room, and my local emergency room wasn't able to do pretty much nothing at all for me. They told me that they do not treat any breast cysts, and I need to go to see a mammologist and to do the breast scan or like breast ultrasound or something. And I'm like, okay, but it didn't work at all. But one part that I hate is I have to be undressed everywhere, like naked. My top part is supposed to be naked, and with this naked breast, I'm just trying to show anything and everything to anybody. I mean that to every single doctor, to every single nurse, and etc. Not really nice. Okay, I go to the second hospital in a couple of days because that thing was growing, and I had one long one and the second one appeared under the first one. So this is basically my breast, and the first one was from here to my nipple, and the second one started forming lower from here to my nipple, and it was forming pretty fast, and it was extremely painful, by the way. I was in pain, and it's not a joke. So what happens next? So next, I decided to go to the second hospital, and that hospital was bigger and more advanced, and they did the ultrasound for me. I showed my breast to the doctor, to the ultrasound technician and doctor's assistant, like everyone everywhere. Yucky, very yucky. And based on the ultrasound, they couldn't find nothing. The doctor said that there is definitely something, but I'm not sure what it is and how to treat it. Just go to see your mammologist or like blah blah blah. And I'm like, oops. Like, sounds good, but I'm still in pain. And of course, when you are in pain and then that thing is growing and there is number 2 appearing under the first one, and my mental health was a mess, and physically I was in pain, I decided to use, they told me that it's safe to use like heat patches, and I was using some of them, but nothing really worked, nothing really helped me. And it's been it's been 2 weeks since I started the process. I went to see my original OBGYN, then I went to see the doctor, like emergency room in the first hospital, and in the second hospital nobody was able to help me. Very stressful. And after that I finally had my appointment for breast exam and for mammogram. So breast exam, which is breast ultrasound, it's just a regular ultrasound that you usually have on your belly when you're pregnant, but this ultrasound happened on my breast, on my left breast. Everything was right here, from here till there. I have a big huge breast, and they did mammogram, they did ultrasound, and they told me right away that my mammogram is completely normal. My ultrasound is kind of there is something in there, and they sent the results to the doctor right away, and the doctor said that it's not cancer, which is a good thing, but it's something that calls Mondor disease. And I'm like, oh, what? Like Mondor disease? Something like fancy. But actually, let me read it for you guys, because it just Mondor disease, it's not easy. Mondor's disease. Yep, Mondor's disease. So, and Mondor's disease. Mondor disease. Okay. Hold on, guys. It's a rare condition which involves thrombosis of the superficial veins of the breast and anterior chest wall. It's like a thrombosis of your blood vessels. Uncommon breast condition. Uncommon. It's caused by inflammation of a vein just under the skin of your underarm. Okay. Not even better. Mondor's disease, uncommon breast condition, is caused by inflammation of a vein just under the skin of the breast or chest wall. It's also known as thrombophlebitis. It can affect any of the veins in the breast, but most commonly affects those on the outer side of the breast or under the nipple. Yeah, it happened to me. That is true. So guys, I had my mammogram and ultrasound, and I went to see mammologist. After that, they told me that it's gonna go away on its own within 3 to 6 months, sometimes within 9 months, and I need to take ibuprofen. But I'm not gonna do this because I'm trying to get safe, and it's not a good idea to take ibuprofen during TDCing. So the next thing, they told me that I need to see a hematologist, which is a blood doctor, and I'm going to do this Friday. No, hold on. In how many? 3 days. Okay. And yep, I will update you guys on that. And also they told me that the reason is unknown. It could be anything, but the first thing first, I need to check my blood because I had miscarriages, and it just, something else with my miscarriages, like Mondor's disease. So also I keep having appointments with my mammologist. And one more thing to add, I do have the third line, which is third kind of vein that is affected on my left breast. My right breast is totally fine. My left one, it's kind of a little bit sicky for some reasons. So, and that third line, cord line, something like that, it's kind of a little bit painful, but significantly less than 2 previous ones. And yes, it's like a process, and first thing, then second thing, then third thing. And so right now it's a blood doctor, so then they're gonna do some blood work on me and something else. It's just a lot. I will keep you guys updated. And moreover, I'm about to change my PCP. That will affect so many things. Still the same medical group, but yeah, I have to change my PCP for some reasons. Yeah, it's like a very important reason. I will update you guys on it later. But so far, Mondor's disease, it's something that happened to me. They told me that there is about 500 cases worldwide, and the doctor, his name is Dr. Loomis, he told me that I'm the first one. He's between 40 and 50, and he said that I'm his first patient with this disease, which is, like he said, it's a very, very rare, and he met me, he found me, and I'm the first one. Yep, funny, but there is no fun at all. Okay guys, I will keep you guys updated after my blood appointment, and I'm still TDCing, and I will keep you guys updated on my trying to conceive journey. Thank you for watching. Bye.